I want to welcome everyone to the Causal Pathways Initiative November coffee break. It's great to see you all here. Some new faces, some long-standing faces. Great to have everyone, so welcome. My name is Rachel Reichenbach, and I support the Causal Pathways Initiative with its external events, such as coffee breaks like this one and some of our other training series. We've had a really engaging year this year with several different training series and coffee breaks, so I want to welcome you to check out our webpage. It's at causalpathways.org. And we have all of our training videos and our coffee break videos there, as well as some other resources. It's my great pleasure today to introduce our guest speakers, Dr. Helen Shipman and Dr. Elizabeth Anderson. Dr. Helen Shipman is an independent consultant specializing in human rights protection, research, and monitoring, evaluation, and programming in humanitarian and development contexts. She has provided consultancy services for the Freedom Fund since 2020, supporting on research and evaluation projects. And Dr. Elizabeth Anderson is the head of research and evaluation for the Freedom Fund. She is a subject matter expert on the exploitation of child domestic workers in sub-Saharan Africa and leads a 10-country portfolio of research on human trafficking issues. And we reached out to Helen and Elizabeth to come join us today because they have produced two reports this year that are really exciting. The first report is called Systems Change in Practice, Pathways Towards Eradicating Modern Slavery. And this report highlights strategic approaches taken to tackling core issues driving exploitation and trafficking. And then the second report, which is going to be more of our focus today, is on measuring systems change, examples from the movement against modern slavery. And this report, if you've had a chance to look through it, you'll see how wonderful it is. It really focuses on highlighting the importance of developing effective approaches for measuring systems change efforts. And the report also features several successful systems change measurement efforts and suggests methods that are well suited to measuring these types of interventions, the types of interventions that the Freedom Fund is engaging on. So we're going to hear more about Freedom Fund's innovative work around systems change measurement in the anti-trafficking sector, and especially dig deep into a case study from Ethiopia, thinking through how do you apply these methods, how do you make decisions around methods, and in particular, we want to talk through how do we think about causality in their research and methodological choices. So we'll spend some time with them today. They'll share a little bit, and then we'll open it up for Q&A at the end. So feel free to put questions in the chat or comments in the chat as they come up, and then we'll also open it up for questions and folks can jump on and ask their questions at the end. And with that, I will turn it over to Helen.
Thank you, Rachel. And it's lovely being here, everyone, today. Really lovely. As she mentioned, Elizabeth and I, we're here today to talk about some of the work the Freedom Fund's been doing on measuring systems change. Just to give a little overview of the session. So we're going to start with a brief introduction to the Freedom Fund, and then I'll do a brief introduction of our systems change reports. And then I'll pass over to Elizabeth, who will introduce our Ethiopia child domestic work hotspot, learning from our norms and behaviour change study, and then also learning from our photo voice study that was also conducted in Ethiopia. And then finally, hopefully there'll be some time for questions, and it'll be really interesting to hear your feedback and your ideas and what we said. All right, I will just pass on to Elizabeth for the next slide.
Thank you so much, Helen. So yeah, just a quick overview of the Freedom Fund before we dive in. So the Freedom Fund is a pooled global fund with the sole aim of helping to end modern slavery. And the way we function is that we identify hotspots of a particular issue of exploitation in a particular geography. And then we work with local grassroots partners who are already working on some facet of the solution to that issue. So we'll work with a combination of folks who work on, advocacy, legal reform, if it's a children's issue, people who are experts on returning children to education, shelter homes, that sort of things. And we'll build out kind of this 360 around a particular issue of exploitation. And so through our investments and support, we aim to shift power so that these frontline organizations, particularly those that are led by survivors of modern slavery, can shape and drive that change, because we understand that they are the ones who have the solutions, who know what the solutions are. And sometimes it's just some teasing out and resource provision that will get us to that point. And within the Freedom Fund strategy, evaluation is a very key arm. So this idea that we're building evidence of what works and what does not work in particular issues in particular geographies. Currently, we are operating in 8 countries, and we have 10 different hotspot programs globally, as well as we are doing research in a couple of additional geographies as well for future work by the Freedom Fund. Let me pass back to Helen, who's going to walk us through the reports.
So yeah, if we can just perhaps just start and talking, as Olivia's already mentioned here, a core facet of the Freedom Fund is that their programming happens through a systems change lens. And it's very much committed to working with change agents to dismantle systems that perpetuate modern slavery. And I think, for example, the CEO and a lot of the senior managers go right through down to the staff and our team on field and our partners. Everybody is talking about systems. They're looking things through a systems lens. And with this in mind, there's been so much dialogue going on. A few years ago, we decided it would be very nice to try and pull all this together and get everyone's different perspectives on what's working. And we're talking about a systems change approach, but what does this actually mean in practice? So we went through a process of key informant interviews, to collecting case studies. We also looked at some learning on systems change from different sectors, the gender movement, climate action movements, and also from the health sector to see how are they also triggering systems change. And then we reflected on our own programming and what had worked, what had not worked. And with this in mind, we came up with what was originally going to be one report. We thought we'll do one report on systems change, and it turned into two. But originally, it was going to be one just looking at how do we do systems change and what does the systems change mean for the Freedom Fund. And then we started looking at our case studies and realizing how much we invest in learning and evaluation and trying to track what impact we're having and for our communities. And with that in mind, we actually split it into two reports. So we had one looking at what do we mean by systems change and how do we potentially trigger systems change? And then the second one focuses on measuring systems change in the modern slavery movement. So the first report, Systems Change in Practice, as Rachel has briefly mentioned, the aim of this was to try and put together all our ideas and make sense of our ideas about what have we been doing that's actually contributing towards systems change and changing the systems that underpin exploitation. So we had a lot of discussions around this, learning KIIs, trying to put together some case studies of the work we'd done, just to try and make sense of what we'd actually been doing. And based on this, we came up with a typology for triggering systems change. This covers 7 types of intervention that can support system change across 3 different groupings. There was one around improving the responses to exploitation. The second one was around shifting norms to prevent exploitation. And then the third one is around transforming power within the system of exploitation. And I think particularly the last one is a real kind of core facet of the Freedom Fund's work, emphasizing the centrality of civil society actors in systems change, particularly survivors and grassroots organizations. And I think under this last one, we had putting survivors at the center of the work and being guided by them and letting them lead the processes, and then also one around building the resilience of communities. The second report focused more on how do we actually measure the systems change. So in our first report, we looked a lot at, we said, okay, here's the 7 typologies, and then underneath it, we reflected on the kind of actions and programming we've done that have actually can contribute to this. We also drew on learnings from other anti-trafficking actors and from the 3 global movements I've mentioned. But then when we started pulling together the case studies, we realized actually there's a lot of innovation and learning we can pull out of the way that we are measuring our systems change programming. So the second report that was originally going to be an annex became a full report. And we decided to say, okay, let's try and put down on paper, what have we found that's worked? Why do we think it's working? And in particular, also identifying causal pathways and looking at how can we really measure impact of our programs. And within this report, we outlined possible approaches and methods for measuring the interventions in our systems change typology. So we have things around what techniques can we use for measuring advocacy, policy advocacy, also the strategic litigation, which is an area of the Freedom Fund's work. So these kind of elements, we try to pull it all together and say, okay, how have we actually been doing that? And then we also produced some case studies that showed some examples of what we've been doing. And throughout the report, I think the 2 reports, we cover various methodologies, including outcome harvesting, process tracing, and also social network analysis. So we put everything together and hopefully it's relatively user-friendly, but that was the aim anyway. And I think based on these 2 reports, it kind of also helped us as an organization to think about what do we actually mean by our evaluation approach? And as Elizabeth mentioned at the beginning, the Freedom Fund places a lot of emphasis on research and evaluation. I have to be honest, coming into this as a consultant, I was really quite surprised. I was brought in for a gap fill for 4 or 5 months, and I was really quite surprised by the rigor of the evaluation approach. It was something I hadn't really come across so much in other organizations. And I think in terms of the approach, there's a real centering of survivors' experiences in the evaluation process to better understand how they've experienced any changes, and also looking at unintended effects. And I think that's something that's really important, not just looking at what's worked well, but also what happened that didn't. And I've put here, there was a study in Thailand was looking at the fishing sector that the Freedom Fund did in partnership with Humanity United, where they looked at the success of some policy change of bringing in a new payment policy for migrant workers who are working in the fishing trade. And on face value, it was a mixed method study. It showed some very interesting findings. It looked very positive because there was better regulation of payment, there was reduced salary deductions, there was better minimum wage compliance. So all in all, it looked very positive. But then I think because there was that extra step of talking to the fishers themselves and saying, how are you experiencing this process and how have you experienced the change? And that's when it came out that for particularly fishers who had their had debts with their employers were holding their ATM cards. So even though the system around had changed, their experience, they hadn't actually necessarily experienced the same changes. And I think a lot of this, the way in which we can find out these unintended effects comes, at least from our experience, in looking to survivors and asking them, how did you actually experience the change process and what was your experience of it? A second key part of the evaluation approach is working in partnership with our evaluators. This is also, on one hand, it's to ensure the approaches, they're rigorous, and they also capture the intended and unintended impacts. But as an outsider, again, I say I'm a consultant here, it's always struck me when I first joined that it really is a learning journey, and I was quite surprised how closely the Freedom Fund work with evaluators. It really is a partnership. And it's often the Freedom Fund who are saying, well, hang on, that doesn't look so good there. And can we do some extra evaluation? And can we do some extra analysis of this? I think the example Elizabeth will give shortly, there was some extra analysis done to try and explore a few elements that didn't look quite so good. So we could try and explain and understand more, what did this actually mean? So there's very much, I would say, a learning journey between the evaluators and the organization. And then, as mentioned earlier, we take time to reflect and document our learning on measuring systems change and conduct further analysis if there are still questions. So I've noticed in the Freedom Fund, often evaluations happen and they're still digging into the data months and months afterwards to try and find new things that can contribute to the new programming. And then in the interest of transparency, I think something that does really help us as an organization is that we've been very, very lucky to have quite a lot of unrestricted funding from philanthropic leaders. And I think, as most people on the call understand, when you have more inflexible donors, where you have quite a rigid, I suppose, sort of meal framework, and you have to report against set indicators, I think there is perhaps more pressure to have the results and to see that we're performing and we're achieving the expected results. But the joy about unrestricted funding is it gives us space to try and really explore impact causal pathways, look to see what's working, what's not. And it gives that space for learning. And I think that's one of the core elements of the Freedom Fund. With that in mind, I'm going to pass across to Elizabeth, and she's going to present some case study from Ethiopia.
Great, thank you so much, Helen. So I want to talk about the Freedom Fund's work on child domestic work in Ethiopia, which we've been working on since about 2021. Child domestic work is a global phenomenon, exists in many countries, particularly low and middle income countries, but we have been working on it particularly in sub-Saharan Africa. And I just want to give a very quick brief overview of it because frankly, it's a fairly invisible population in the global health and development spaces. So essentially, this is children and adolescents who typically, but not always, are emigrating from rural to urban areas to work for a family in exchange for board. Oftentimes, there is a hope or a promise of some additional education. Maybe in their home area, there were limits on how many years of schooling would be attainable. But if the child comes to an urban area, they're hoping to continue on in school. That doesn't necessarily always come to fruition. In Ethiopia in particular, though this is not universally true, it's a very gendered issue. When we talk about child domestic work, we pretty much exclusively mean girls. But in other countries where we work, that's not the case. It's boys and girls. And so we have been working under our hotspot model since 2021 to shift perceptions and treatment of CDWs, which is child domestic workers, in Addis Ababa. And at the time, the grantee partners were coming together and convening to build this program. We had them working on identifying how many barriers they possibly could to barriers to change. And so that it's been this kind of living conceptualization over time as different programs have succeeded or failed. They revisit this environment in which child domestic work is exploitative. And frankly, as new evidence comes out, that's kind of shifting this living theory of change around what are the barriers and access points to improving the treatment for these children. In Ethiopia in particular, although again this is fairly universally true, some of the key issues that make child domestic work exploitative, though not all child domestic work necessarily is exploitative, would be the number of working hours, the denial of access to education, lack of access to rest, lack of pay or delays of pay. And then, yeah, just other issues that prevent children from accessing their basic rights as children within the contexts where this is happening. But again, as Helen mentioned, we have the systems change approach where we're combining initiatives that are designed to trigger change in different like pain points of the system that are underpinning the exploitation. So for example, the families that these children are living with are themselves generally quite impoverished. And so what are the barriers that we can reduce for those families to allow them to have space to treat these children better? And so some of the activities we have done in Ethiopia have included response work with CDWs, so shelter provision, safe space provision, but as well as raising awareness with employers and then policy advocacy with local and national government. And next slide, please, Helen. So we have really these two flagship evaluations of the Ethiopia CDW program that I wanted to go over today. And they're really assessing whether and how the treatment of CDWs is changing as a result of the program. And understanding that this is a very volatile environment. There are a lot of things changing all the time. And so identifying causal pathways is tricky within this very invisibilized population. So the first one that I'll talk about is this quantitative pre-post survey of some employers who received or who lived in intervention areas that received a norms and behavior change campaign. And that campaign really helped us to refine our approach to measuring change and then tracking causal pathways using the second evaluation, which was directly with CDWs. And we used a photo voice longitudinal approach with the domestic workers themselves, the other children of the employers who were living in the household, and then the employers. And these are all people who have participated in an intensive educational support program versus a control area. All right, next slide, Helen. Thank you. So this norms and behavior change campaign, we worked with Girl Effect to come up with a fairly what at the time was a fairly innovative campaign because it was there was a TV-based component. So essentially, they scripted, directed, and then filmed essentially this telenovela series. And so they were less than 10 minutes each episode, but there was this dramatization of this CDW and the employer and kind of the situation that she was in. And at the end of each episode, folks had the opportunity to text in, what did you think of, how the woman treated the child in this particular scenario? And they could rate how they thought the woman did. And then, they could comment as well. And we got some really interesting qualitative responses from that. But then we also had some in-person discussions with employers, which were, of course, opt-in, and then some posters and other educational and awareness-raising materials in the community. And the goal was very much around improving employers' treatment of CDWs. And it drew from research that where CDWs felt were the issues or the topics that we should push on around the norms that they felt were preventing employers from improving treatment of CDWs. And the questions we asked were things around, do CDWs have the same rights to education as other children? Do CDWs have the same right to play as other children? Those sorts of things. And then for the evaluation itself, we did a 2-time point household listing with about 700 employers in 2 areas, one who had received this intervention and one who had not. And so we did, and then we combined that with some ongoing qualitative data from the partners, so including their reflections from these in-person sessions, as well as the texts that people had sent in and kind of how people were responding to the messaging over time. Let's move on to the findings. Thank you. So then the key findings included that CDWs may, well, first, that CDWs may have just experienced the program differently. There were some positive changes in between the intervention and control sites. We saw a reduction in like the othering of CDWs, improved attitudes towards rights to education. We found that more campaign exposure was linked to better improvements in positive attitudes, but this could also reflect that people who already had better positive attitudes were more likely to interact with the campaign. One interesting note that I don't believe I've mentioned here yet is that in Ethiopia, about half of the girls that we have surveyed in all of our studies are related to the employer, and then the other half are not in a familial relationship with the person that they're working for. So employers who related to the CDW reported shorter average working hours and were less likely to agree with statements that the CDWs had fewer educational rights. But then, as we move forward, we'll highlight now. These families also generally aren't paying the CDW anything. So it's kind of seen as like they are giving a gift to their niece or their cousin or whoever it is by allowing her to live with them in Addis Ababa. And so this is typically, I think, where most evaluations could stop, right? We had some statistical evidence that the campaign was doing the things that we wanted it to do. Employers were reflecting more positive attitudes. They were resonating with some of the messaging around, religious elements of like, God favors people who treat children well, that sort of thing. That was really resonating. But that doesn't necessarily mean that the campaign was the trigger, and it doesn't necessarily mean that it's translating into a behavioral change that's affecting the CDWs. So we did some more investigation. So despite this, the innovation and the reach of the TV show, so we found a phenomenal reach of the TV show. We actually found that the in-person interventions were the most valuable, based on the feedback from the partners. So because they allowed us to dig into some of these things that these one-off TV campaigns didn't. So there was an opportunity for partners to address misunderstandings and misconceptions. So sometimes in the text responses, we would get things like, you're criminalizing but I'm actually giving this child a gift. You're not this. Everyone here is grateful that I'm doing this wonderful thing, and you're making it sound like it's bad. But then giving the partners a chance to address some of that and talk about gaps in treatment between the CDW and other children in the family. The personalized interventions allowed employers comprehension to go deeper. And I mentioned this a little bit, but the messaging between familial versus non-familial employers turned out to be critically important, because familial employers don't consider the child to be an employee, and they will say, "Oh no, I treat her the same as my other children," even though the CDW herself is not necessarily agreeing with that. And then there was also an opportunity to adjust messaging to suit dominant norms. So, for example, our partners observed that positive deviance messaging really resonated with the employers, since child domestic work is seen as something that offers children a chance at a good future. So being able to kind of shift some of that towards, how are you, the adult, preparing this child to enter adulthood in a way that's going to give her the best outcomes. And, oftentimes the answer to that is access to education. But reframing some of that messaging towards positive deviance, and that these are, allowing the employers to see themselves as, important and good adults in this child's life, and not just in this transactional employment relationship. Next slide, Helen. So some of the things that were still not clear, as I mentioned, we don't know how CDWs viewed this reported change. So one key note that, even as we received the initial results of this study, was that the number of hours that the employers reporting that a child worked on a given day were dramatically lower. It was about half as much as the CDWs had said in our prevalence study that they were working in a given day. And part of that was the employers weren't counting the in between time. So the child was expected to be on call 16 hours a day, but she only had active work for 8 to 10 of those hours, and so they were only counting 8 to 10, even though she couldn't leave the house for 16 hours a day because she didn't know when the next task was coming. We also didn't know whether it was harmful or beneficial to frame CDWs as family. And again, it's this concept of, oh well, if she's your family member, then she doesn't have workers' rights because she's not in a work relationship. And so kind of figuring out the balance there that would ensure that children had access to rights from a labor perspective. As Helen mentioned, we did some additional analyses on our quantitative data, and it really pulled out that there was some social desirability bias around the school enrollment questions in particular. People were just left them blank. Almost half of respondents left those questions blank around whether CDWs had a right to go to school, whether they had a right to go to day school versus an alternative form of education, et cetera. And then another thing that we learned from the extra analysis is that so when we had done these household listings, we kind of just spoke to the adult who answered the door, right? And we weren't necessarily considering whether it was the head of household, which is typically the man, or the household manager, which is typically a woman. And if it was the head of household who replied to the survey, they were often dramatically underestimating the working hours compared to other adults who replied to the survey, which means they probably don't know what that child is doing during the day because they're out working. So just simply a lesson learned around who should be replying to our surveys. And then Helen, let's move to the next program, which is the NIGAT program, which is actually we've just wrapping up this program and evaluation this year. So this was a more longitudinal study, or rather longitudinal intervention with employers, CDWs, and then the other children of employers who we saw as a potential avenue for conduits to talk about the rights of CDWs and advocate for their treatment within the home where they're both co-living as children. So Nigat means dawn, or like the dawn of a new day in Amharic. And so the idea was that, again, this was an opt-in program where families participated over a series of many sessions that touched on a variety of things. So the CDWs themselves got support to return to education. They got psychosocial support where appropriate. The children of employers got some school-based education around the rights of children generally. And then the employers got education, again, yes, on the rights of children, the rights of workers. And then they also got some financial or non-financial support. So they would get things like school supplies for it's a, you know, if they said, well, we can't send her to school because we can't afford a backpack for her. Okay, well then here's the backpack. Or she doesn't have a mattress. Okay, well then here's the mattress. That sort of support that these families received. And again, we had a control area, and we did a 3 time point evaluation that was really centering the CDWs themselves. And so we decided to do a photo voice approach to understand how the CDWs were perceiving the change. And so essentially at the 3 time points, we gave the children in the study a camera, and we gave them a prompt and say, take a photo of something that makes you scared or makes you feel hopeful for the future, or whatever the prompt was. And then she would take this photo and tell us what she thought it meant, why she took it. And then they would all come together and they would talk together about the photos and what they meant. And so a couple of examples that I've got here on the screen. One girl took a photo of these jerry cans full of water, and that was something that just really made her feel despondent, that she had to carry this much water every single day, and that was just too heavy of a load for a child to be doing alone. We don't have the photo on here, but one child took a picture of a slipper that the woman of the house was using to either threaten her, or she would throw it at her or hit her with it. We didn't include the photo of the slipper in case the woman recognized her slipper in the photo. But that sort of thing that really allowed us to uncover like hidden realities through symbolism, and allowed the children to dictate what they thought were the changes and what was causing the changes to occur within the intervention. All right, moving on to the findings. So the CDWs in the intervention sites absolutely reported a significant improvement in living and working conditions. Nearly all of them were enrolled in education at the end of the intervention. There was a significant reduction in experiences of verbal abuse. And then the other noteworthy finding was around reduced consumption of poorer quality food than other children. So they were no longer being given worse food than other children in the household, or eating separately from the employer's family. And then we also found that the employers in the intervention group improved their exhibition of empathy for the CDW at endline. However, and also in the interventions, the non-intervention sites, we saw some improvements on each of these variables, but albeit much smaller. But that shows that there were some other factors that we can't necessarily identify that were influencing change over time. Another note here, a very key limitation of this study is obviously an opt-in, right? So the employers who had a desire and intention to improve their treatment of the CDW or to make her conditions better are the ones who opted into participating in this intervention. And the folks who are, probably the most abusive or exploitative simply did not participate in this intervention. So moving on to why we think the change occurred. And again, we really focused the CDWs as the base for kind of formulating these questions around why they thought change occurred. And then we were using other groups of respondents through key informant interviews, in-depth interviews, and focus groups to triangulate and corroborate what the CDWs thought, or to add some more context to it. So for instance, consistently across all of these data sources, we saw that some of these positive changes in relation to meal practices were directly attributed to specific household training sessions by both employers, children employers, and some of the key informant interviews with stakeholders in the community. They were all saying this was the thing, this particular session was the thing that caused that to click for the employers. And then we were able to triangulate as well, what CDWs versus other groups saw as the direct contributors to the change. And that we had also specifically aimed to explore why the change had occurred. That was always a very key element of this evaluation. Next slide. Thank you. So some of the shifts resulted in improved action, or did not improve improved actions due to economic barriers. And frankly, I think this is an expected outcome. We didn't correct the economic situation for the families that are employing these children. As I mentioned, these are not well-off families. These are fairly impoverished families themselves. By the midline, over a third of the employers recognized that CDWs may not see their living conditions as adequate, but they also don't have the material means to make the changes that the child deserves to see changed. Practical employer support was a key element in increasing daytime attendance in school. But despite this, there were still substantive barriers to accessing school, including, again, the above, that the family simply needs someone in the home doing these chores, and there's not a clear and obvious replacement for that. However, I think here that the intention, the shift in intention, is really significant, and that is one of the key legs of changing treatment at scale for child domestic workers in Addis Ababa, is changing this understanding that these are children. Well, A, that these are children and they have the rights of other children, but B, that they have particular needs and obligations, or rather the employers have particular obligations to them. There were also some ingrained cultural norms that were inherently resistant to change. So the majority of the CDWs who were never paid worked for relatives. And again, this is kind of seen as a familial duty and also a gendered duty, right? This is women's work. And so women in the family just do this work. It's not seen as labor. And so this justifies the non-payment. Even though, again, as I mentioned, the CDWs didn't agree with this. They did not feel that they were being treated the same as the other children in the household, who were the natal children of the parents. And then finally, moving on to the CDW's experience of the change. So CDWs who reported improved meal practices said they had more energy. They were probably better nourished. Again, these are adolescent girls, and this is a critical time in their lives to be receiving proper nourishment. And so more so than the quality of the food, the CDWs saw the shared meals as a symbol of respect and equality and being part of the family. And so that to them was oftentimes the most important change, was feeling that they were part of the family. And that was not something that was necessarily on our radar, right? That's not something that there's a question for on child labor surveys, is do you feel that you belong? Do you feel that you are wanted at the table? That sort of thing, but that this was really transformational for them. One finding that stood out to me in particular is that while some CDWs felt that they didn't want to share a room or a bed with other members of the household, and that kind of tracked with our understanding, was that no, she should have a hygienic space with a closed door to sleep, right? She should have, a mattress and a door. And the opposite proved to be true, particularly with some of the younger CDWs, is that they actually saw bed sharing as a sign of inclusion, and being assigned to sleep in a different room was actually a form of exclusion. And so and that was a loss for them of status and closeness with the other children in the household. And that was a thing that made them feel othered rather than as one of the children in the family. The CDWs said particularly that these senses of dignity and belonging were signs that the behavior change will follow. And that these small, more symbolic behavioral changes, like eating together at the table, they felt very strongly that that's going to lead to things like better chore sharing with other children in the household, and things like that. And the photo voice really here gave us the ability to let the children set the terms for what change counts. So we didn't tell them which things. They got very little instruction on which things we were actually looking for. These were all things, the mealtime practices, the sleep practices are all things that they came up with. And so the meaning of sharing a meal with the family, the meaning of having your own blanket, the meaning of being able to call your mom without permission, or even with permission. A lot of times these children aren't able to ever call their parents or call home. But those sorts of things are so significant for this population. And it allowed us to address the power differentials that are inherent in evaluations. We weren't going through adults to get this information. We weren't comparing adult versus child data directly in a way that kind of circumvents a lot of the power differentials that in many evaluation approaches are preventative to understanding the children's perspective. And then I have one more slide, and then we can open for discussion. So this in-depth engagement with CDWs and the children of employers allowed greater understanding of the role that the children were playing to contributing to the change. It really underscored for us that the agency that children have to be change agents, and whether they are the CDWs themselves or other children who are closely linked to the CDWs, and seeing that as a very bottom-up approach to making change and demanding change. And there was also some evidence at the community level that things were changing. So there's some traditional, like a mutual aid structure slash traditional governance structure called an IDER in Ethiopia that's very like micro community level. And so people are members of these IDERs and they have bylaws. And some of the IDERs that we have worked with have now taken up into their bylaws things about treatment of CDWs, and you can be kicked out if you are found to be violating those bylaws. And it also gives the CDWs themselves standing to come and make a complaint in a way that they wouldn't necessarily have had access to before. And it's and again, it's a very child-driven change. And the qualitative engagement with employers produced some of the same themes as this norms campaign, but also more in-depth explanations for where normative change programming will and won't work because of structural barriers that no amount of norms change is going to influence. Okay, moving on to this last slide, we can share the Research Freedom Fund address if you have any follow-on questions after this presentation. But other than that, I think we are happy to open for questions. I'm going to catch up quickly on what's here in the chat, but I think we are happy for anything to be dropped in the chat, or if anyone has a comment that they would like to share, that's fine to unmute and do that as well. Okay, so the first thing we have in here is evaluators. So Nikki says, when you mention evaluators, who are they? Are they working in the field? Yes, we almost exclusively contract with evaluators who are from and based in the countries where we're doing the evaluations, and that's a priority for us. They bring a very needed perspective, and are able to do that work directly with the communities. There are exceptions to that, but for the most part, yes, we work with extremely locally based evaluators. And then the question on response rate for surveys. So I would have to check, Nikki, on what the response rate. So this was a door-to-door, like they knocked on doors type of methodology. I would have to check what the response rate was for people who refused or weren't home. But yeah, this was all within households that we knew had a CDW. So we went and checked if they had a CDW, and then we came back and surveyed them. So yeah, we have a question from Steve on if we have any more information on the in-depth qualitative methods which you used. Yes, I would probably direct you to the report that Helen was presenting on. We can drop the links to those in the chats, as well as this photo voice report that we've done recently. Helen, do you want to take? I'm just talking through them. Do you want to take any of these?
I'm scrolling through now. Which ones have you gone to? Yeah, I think there's one around the evaluation finds it fascinating. I'm not sure I'd call the measurement of systems change level. I wonder if this could be explained a little bit more. And then I think a few people talk about this. Yeah. I think in terms of the whole program, I'll let Elizabeth step in after I've said something. There were other elements of the program, but we were looking in this particular, within our systems change measurement typology, we have areas around normative change, also around sort of the policy level, and Elizabeth mentioned like with the IDEs, I'm pronouncing that correctly. That is sort of like to the local policy level, local governance level, and there was advocacy done to them as a part of it. The employers, who under our typology would really fall around changing around sort of we have a thing around harmful business practices, and the employers are effectively the business or the employers, the business. They would fall under that, put it that way. So within the evaluation, even though within the slides we focus quite a lot on the normative change, because that was sort of the focus of the evaluations, we also did try to look at the other things around it, like did we change the policy, the advocacy, how successful was that? We talked to the children, we talked to the employers. So we looked at it from, I guess we sort of framed the program from the systems change lens we'd started with, and then we tried to evaluate different elements of it. Is that fair, Elizabeth?
Yes, absolutely. Right. And I absolutely agree with these comments as well, is that, we're touching on a micro group of folks who've received this particular intervention. And this is, I would say where we are at as the Freedom Fund in this program is that we wouldn't be saying that we've created this systems level change. The NEGAT program was not huge. And so this is more a proof of concept, that we have the opportunity to do some systems change measurement at scale as this program continues to scale, and that we now have some touch points for what to measure, and that we have this data from the children in particular on, well, what are the appropriate indicators of system change.
I know. Somebody's asked, have any research measures you found most useful in measuring systems change? Excuse me. I think if you look at the reports, we found that different methods of use have worked for different types of system and different programs. We've had outcome harvesting, process tracing, and also social network analysis. I think that they're the ones that would spring to mind, Elizabeth.
Yes. Yeah. Yeah, there's several in the report that we haven't necessarily worked on ourselves as the Freedom Fund, but that other actors in the field are using to great effect.
I also noticed there's one about a framework or a theory of change to guide the study. The program itself had its own theory of change. So that was used as sort of the guiding framework when starting the evaluation process. And I think the theory of change, it had quite a strong focus on policy and on normative change from memory, as well as the response services. The response services, I think they were evaluated more through perhaps the day-to-day monitoring and obviously trying to catch the outcomes. But I think that's why within the evaluation there was a stronger focus on perhaps the slightly harder ones to catch, like the normative change and the impact of the advocacy.
Sorry to kick back to immediately again, Helen, but this question from Carrie about how do we approach the development of case studies? How did you structure or work those conversations? And I'm guessing this is a question about the systems change reports and how we selected those case studies.
Yeah. It took quite a while, to be honest. I think that there was quite a lot of discussion. We had some internal meetings, internal brainstorms with the country teams as well, hotspot teams, as well as talking to different people at all the levels of the organisation. I think a lot of it came down to we asked within the team. We said, where do you think this being the most learning? And we try to focus more on learning, not what's been the most successful, but I think where have we learned the most? And that was sort of the starting point. And then based on that, then we sort of we picked out some. We formulated a lot more than are actually in the report, because we thought, okay, well, let's try. And then after we developed the typology based on the case studies and the learning from that, then we thought, okay, we'll do perhaps 2 per one of the 7 elements of the typology. So we actually, a lot of the typology was actually deriving from case studies of what had worked, what hadn't worked, and what could be useful learning. And then we chose them to kind of fit, so it wasn't an unwieldy document, put it that way.
The last one I'm seeing in here is around the definition of systems change. Helen, did we have a particular one in the document, or if not, we can just kind of talk about how we conceptualize it?
There is a page on it where we talk about how and I think we focus a lot on the different elements to looking at root causes, looking at change agents, the interaction between change agents, looking at power. But yes, there is a definition within the report, but I think we felt it was important to take a more, not just say systems changes about, addressing root causes, but also look at the relationships. So that's why we have the change agents element in there as well.
Yeah, absolutely. Okay, and then Lena has a question in here about comparison groups. Do we view them as outside the system? No, I wouldn't say so. I think it's more of a intervention versus non-intervention group in the absence of ability to do any sort of randomization or experimental study at this stage. And no, and as much as possible, the comparison groups are comparable, right? They're similar to the group that where we're doing the intervention, so that we can try to approximate what is changing external to the Freedom Fund's work in parallel to what we are doing, and try to like subtract that difference.
And I think with the norms, I remember the norms behavior change campaign, there was a lot of discussions and tracking at the time as doing the evaluation, tracking the contextual changes, a lot of sort of reflection group, workshops with the partners and discussions around what could have contributed to change in the other areas as well. So a lot of constant reflection and looking at what else could be contributing to change. Is that all the questions?
That's all I'm seeing. Rachel, do you have anything else from your end?
Maybe we can just open it up if anyone wants to come off mute and ask a question. We do have a few minutes. Lucia?
Hi. Yeah, thank you so much for sharing. It was really, really great. And also to see the breadth of different tools that you used. I think it's really interesting to see that put in practice. I was wondering, you were sharing earlier about the challenges to find causal pathways, especially in this kind of work. And I know that especially in systems change, where you can mostly focus about your contribution. And could you tell a little bit more about what worked for you, especially with your approach that seems to be, very rigorous and yeah, I imagine you paid a lot of attention into that.
Yeah. So, and Helen, please jump in here as well if you have other examples. But I think one of the key items that we have included in our evaluation approaches is asking people about particular recall. Have you, for this TV campaign, we showed them stills from the campaign and said, do you know what's this girl's name? And to try to confirm whether or not they had seen the content. And then with the photo voice study as well, we asked in every single, key informant interview, we asked in the photo voice component, et cetera, why do you think people started making this change? And then tried to draw them back to, because the ex-partner gave that particular presentation, or because they gave us the backpack, or whatever it was, and letting people to say for themselves what they thought the change was. Certainly this does not give, the full 360 at the, this is a very bottom up understanding of systems change. And we don't have that top down element in this particular approach. I think, as we continue to expand and understand our programming and look at, other expanding to broader swaths of the population in Addis Ababa or other places where we're doing this work, that will be easier to do that top-down approach as well. We did do as I think I mentioned, a baseline prevalence study in 2020 or 2021 with CDWs in Addis Ababa. And then we are planning for 2027 to do a follow-on prevalence study. And that gets really into the different forms of exploitation, particular issues of maltreatment, hours worked, the proportion of girls who are out of school, et cetera. And this follow-on prevalence study is going to be very much focused on like harm reduction, rather than the reduction in total prevalence of children in child domestic work. And hopefully that's going to give us a bit more of, again, that larger scale triangulation of, okay, now we have this really good bottom up understanding of what's causing change. And then can we have a top down understanding of, okay, but at what scale is this change happening? Helen, do you have anything to add to that?
No, I think that was comprehensive.
It looks like we have another question in the chat. I also have a question too. I was wondering if you could share a little bit about how this research has influenced program decisions, if at all. Has it made program teams think differently about what aspects of systems change should be focusing on? This is primarily focused on norm change and some advocacy. So I'm curious if the program teams have thought about bringing in other elements of systems change work into the program.
Yeah, absolutely. I think that one key learning from particularly the Norms campaign is the initial thinking with the partners shifted or was more centered around well, if we encourage people to do the right thing, to see themselves as a good person, a just and holy person, a good aunt or uncle, whatever, those are going to be the things that are causing the change. But it's actually proven not to be true, that the people who are seeing themselves that way then don't feel any need to make any further changes. They say, oh, well, there's bad people, but I'm a good employer. And so shifting to, well, no, actually, these are people, these children are, while they're laboring illegally, do have access to labor rights, even though they're laboring illegally. And so moving more towards getting people to think of it in a more, frankly, transactional way, and that the CDWs themselves understand the transactional nature and what their contribution is, and what their rights are and what they can demand. In a way that addresses both employer concerns and the children's concerns, and we're encouraging them to make contracts between the child and the employer. It'll have like a calendar of like Saturdays are her day off. You can't ask her to work on Saturdays. But then also that the employer is getting what they perceive as the fair end of that deal. And a lot of that has come out of the research. This last question in the chat. Here comes another one. Could you say a bit more about how you assessed interactions and relationships with different levels of the system or different groups within the system, how they influenced each other? Yeah, so I think, and again, this is all kind of like post hoc between validation or exercises with the stakeholders, so we'll go and collect the qualitative data, write up the report, and then do validation workshops with our partners, with government stakeholders, with community, local, traditional leaders, people like that who can tell us what do these disparities between the groups mean. And to try to get to some convergence on that. Oftentimes it's with limited success, but we do always attempt to do that, to do some of that sense making work. Helen, I don't know if you have any examples from perhaps the Indonesia study.
Was the Indonesia, which is that one, the one that the social network, which is a social network analysis?
Oh, yes, that's the one in Brazil. Yeah, so we did a social network analysis of how people were, building into a movement with some of the work that we supported in Brazil in particular, and on how different actors, especially comparing between survivors and non-survivors, were part of the movement, how they were benefiting from different resources available at different levels of the system. And looking at any disparities between survivors and non-survivors, and finding that people who, how long they had been in the work or how intensely the work was, what proportion of their life was spent on it, which influenced how much time they had for things like rest, or opportunities for training because they were so intensely involved in the work. Yeah, I think that's a really good example of how we particularly tried to assess how people or actors are influencing each other, even as they're working at different levels. Be happy to share the link to that one as well.
I think you need to answer about the resources, Elizabeth.
I'm sorry?
The question about what resources went into the evaluation.
I guess. So, well, I mean, in terms of like financial resources, we had budgeted for this from the beginning of the program, understanding that we wanted to do this particular evaluation. In terms of staff time, we're very lucky to have a fairly robust research team who's able to put time into developing tools, refining tools, working with local providers and suppliers. The other element is that we do, in each of our studies, make asks of our local grantee partners to participate in, writing the research questions and then validating the report itself. So that does represent a resource suck on their time.
I see one last question about the importance of local experts on the research team. I think that's absolutely essential. And I think in the Freedom Fund, there's very much a feeling of in all the evaluations that I've been sort of involved in or overseen, or the research over the last number of years, it's always been local experts, just so you get the insights. And I think also to think about the power dynamics, because it's very easy to kind of bring in an outsider and sort of fly them in. They do the evaluation, they don't really understand the context as well. They don't understand the dynamics, and it also introduces that very, very harsh power dynamic. And I think if we're going to be saying we're working at this, for a survival end, we're centering survivors, right at the center of the evaluations, to have somebody who at least understands the context and can speak, even base level, speaks the same language. And I think even then we're still very aware that even when you bring in local experts, there is still a very clear power dynamic. So we're not eradicating that power dynamic, but I think it's just it's part of the Freedom Fund's approach, that we very much believe in investing in grassroots partners, be it through programming or through evaluators and research, and that's also part, but by investing in the local experts and getting them involved in the research, because we do this partnership approach to the evaluation, I also feel as a bit more of an outsider looking in, there's also an element of capacity development as well, and learning from each other. We learn from them, they learn from us, and it's a really nice kind of partnership of everything. I mean, I've learned a ton from working on evaluations from the local evaluators we've worked with in the universities, and it's been really, really enlightening, and a real kind of privilege to be involved in them. So I think for me, it's all about just investing where we should be investing, and being as mindful as we can about the power.
Yeah, just one quick example to add to that for the photo voice study in particular. When we tendered that study, we couldn't find someone who had any expertise on photo voice in particular. And so the local firm that we ended up hiring, we gave their enumerators and their staff training on photo voice from a global expert on photo voice, so that they would then be able to take that methodology forward themselves.
Wonderful. I just want to give a huge thank you to you, Helen and Elizabeth, for such a wonderful presentation. I really feel like your perspectives helped us deepen our understanding, and really give us a practical example of how to do systems change measurement. And especially this focus on norms and beliefs, really thinking about how do you measure that? How do you start to understand how those who are most affected by the system and by that aspect of it, how to measure that and how to work with them. So thank you for sharing your perspectives with us and your research and experience. And thank you to the participants today for your time and your attention. Carolina has put up a poll here. If you could fill that out while we're closing up, that would be very helpful. Just give us some feedback on how was this coffee break for you. There's also another opportunity to provide more formal feedback. You should have received an email yesterday from the Causal Pathways Initiative with information about participating in an opportunity to share your causal pathways story. We're coming up on 3 years of the initiative, and we really wanted to gather some insights on what the initiative has accomplished, how it's been helpful, and what direction we can head. So we will be using a interactive storytelling platform called Amufy to capture qualitative experiential data, and we really hope you'll consider participating. If you haven't received that email, please reach out to Carolina, and she can make sure you get a copy. But it's really for anybody who has participated in anything causal pathways related this year, which you are on this call, so you count towards that, and we would love to hear your experience with causal pathways. And with that, we will close our coffee break. So thank you, everyone, and until next time, please take good care.